Okay, so next is going to be the demonstration of ventilating a pediatric patient. So most of the controls involved with ventilating a pediatric patient are the same as an adult. So as far as like the different alarms and settings, everything is the same. Remember, using the same circuit as long as our patient is greater than 10 kilos. So remember that difference. Other than that, most of the competency is just going to be walking through the pediatric protocol and using some scenarios to make sure that you know which mode to ventilate. But just as a quick review, with our pediatric patients, you have a few different options. So first off, if your patient is greater than a year old or the patient does not have lung disease, then you have a few different options, but primarily you're going to be using a volume mode, which would be these top two. So we have SCMV plus, which would be like what we know as assist control. And then we also have SIMV plus. And then per our protocol, if the patient's less than a year old, or if the patient does have lung disease, then we're going to use a pressure mode. So our options here are either going to be PSIMV plus or PCV plus. Okay, so both of these are pressure. This one would be like assist control pressure, and this one would be SIMV pressure. Okay, so if you select PSIMV plus, remember that you're going to have some different controls that you wouldn't normally have. So here we're going to be giving an inspiratory pressure. Okay, so per our protocols, that is based on their age. So if they're less than 12 months old, that would be 15. And if they are greater than 12 months old, then we would be changing this to 20. Also, we're going to have pressure support. So per our protocols, if they're less than 12 months old, our pressure support is going to be at 10. Now you can see that this is grayed out. That's because we have P sync on, which syncs our support and our pressure control. So I'm going to go ahead and deselect P sync. And now you can see I can change our pressure support. So if our patient was less than 12 months old, we would go ahead and change this to 10. That's really the main differences. Otherwise, it's just being familiar with the protocols, but just wanted to review how to find these different modes, and we can discuss more about what the actual differences are when we do our skills checkoff.